After this very exciting presentations, discussions with the panelists, which was more on affordable healthcare, I'd like to deviate to accessible healthcare. Schiller is a Swiss company. We are a subsidiary of Swiss company in India. And we have products which is called Smart Line projects for technologies. Yeah, it comes with a cost for sure, but we feel that we should, our people in India should also have access of new technologies, right? What I see looking at India, access of the patient to the diagnostic centers, the hospitals, also one of the important issues which we want to address. So we have mobile CT scanners, right, which is something very proprietary, where a patient doesn't need to go to a diagnostic center, the CT comes to them, right? We're honored to have the first one at KEM Hospital, right? Like in the previous talk, somebody talked about the golden hour and the trauma care, right? We have one body tom at KEM working. What I'm going to talk about is a mobile stroke and a trauma care unit. This is a very revolutionary concept, which was founded in Germany in 2007. It took them 3 years to apply that on the roads, and they've got the first MSU, the stroke unit, in Germany in 2011, followed by US in 2014. We started this concept in 2016 in India, right? This is a CT which can be installed in an ambulance, and if you know stroke, which is, I'm going to some presentations on the stroke. The early detection in stroke, right, where you can administer the TPA. I feel most of us, if you see, have come across this eventuality when a person has a stroke and they cannot have an access to a CT scan within that golden hour, right? They go to emergency centers, they don't have a CT, or they don't have the technologies there at place, and by the time everything is damaged. This is one of the causes of death. I move forward because I have lesser time, but this is one of the important mortality in India, right? Stroke. So what the revolutionary we want to present here is how to transport such patients. So you bring CT to the patient. It works on a battery. It's an 8-slice CT scan, right? It can do angios, it can do perfusion, everything on the bedside. We're taking care of all ARB requirements in terms of radiation dose. It gives you 1/10 of the dose which a fixed or permissible CT scanners gives. It has a telestroke, so accessible healthcare is important, where it's not necessary that if a person has a stroke, right, a neurologist is present there. He can go to a remote area, it has a stroke, the images can be transferred to a neurologist. He can diagnose it, and by the time the patient reaches the hospital, everything is ready. He doesn't need to wait and get a scan done. We are proud to have the first one in India. It is in Coimbatore. And they are doing a pretty great job on this so far. I'll show you this video.
Developing countries like India are facing a double burden of communicable and non-communicable diseases. Brain stroke is one of the leading causes of death and disability in India. There has been more than 100% increase in incidence of a stroke in low and middle income countries, including India, from 2008 to 2018. Indian Council for Medical Research, ICMR,
hospital.
Patients with a brain stroke need to be taken to the hospital in the first hour of getting the stroke, also called the golden hour. During this time, there is a 4.5-hour window for treatment, which needs to be administered to the patient on an urgent basis. Schiller India, in collaboration with Neurologica Corporation of USA, has been proud to deliver the first mobile stroke unit of India at KMCH Coimbatore. These specialized ambulances have made the diagnosis and treatment of many neurological emergencies, in addition to ischemic and hemorrhagic stroke, a possibility at the emergency site. This has resulted in faster treatment for patients with acute neurological emergencies in the pre-hospital stage, giving them a fresh lease of life. The mobile stroke unit is a specialized ambulance that consists of a CT scanner and laboratory equipment essential for the diagnosis of a stroke. It has a team of paramedics and a CT scan unit.
This vehicle has got three main areas. This is the area we showed you, which goes inside for the doctors and the technicians to enter, handle the patient and do the CT scan. The second area is this, which has got the oxygen cylinders and also has got the outdoor unit for the air conditioning system. This is an isolated unit and the batteries are above that, which is necessary to run the CT scanner. We have again another compartment which handles the generator. The generator is necessary for us to run the air conditioning. Also, it is a backup in case the battery fails while doing a CT scanner. This is a mobile CT scanner, which is the heart of the machine. This is what will do a CT scan on the roadside in a remote village so that we can diagnose whether the patient has bleeding inside the brain or a blocked vessel. Once the CT scan is done, the images are transmitted from the ambulance to the main center. This is like an ICU. This is a ventilator. This is the monitoring device. This is a defibrillator. We have got everything that an ICU needs to resuscitate a patient. Now this lift is necessary to ensure that this stretcher can be removed from the ambulance. This problem does not exist for regular ambulances, but in this ambulance we have taken this precaution.
The patient phase of the process is performing CT scan of the brain and proceeding with therapy, which includes intravenous TPA in the ambulance within the golden hour.
The doctor then told me about an
This is one of the testimonial of the patient who got a CT scan done. She had a stroke, right? And they could get a scan done within the time frame and they were sent to the hospital and the patient is fine. One of the things what we were discussing in the last presentation is affordable healthcare. I agree we can do that. Like the CT scan come from US. We have ambulance coming from US, which is very expensive from Fraser. We fabricated this ambulance in India, and the cost has come down considerably down, right? Like 1/10 of the cost what the Fraser sells in US, right? From a Bharat bench or any of the local vehicles having a 10-ton load. So we can reduce the cost with affordable solutions within India, which we have fabricated and made in India. And we are trying to project this as one of the smart city concepts, technologies for disaster management, stroke management across India. Thank you. Yeah.